Watch as the low back, the lumbar spine, how one bone shifts backwards. And you see all the red area? That is what leads to joint issues. So you have inflammation around the joint, pain syndromes, and then two, it's what leads to nerve issues as well, because actually that bone will start to move backwards, cause tension on the spinal cord and the nerves, inflammation around that area to affect the nerves. So therefore people may have sciatica. Also, those nerves go to the pelvic organs. So I've seen a lot of patients when one bone shifts backwards called a retrolisthesis, where they'll even have lower intestinal issues like constipation, diarrhea, bloating, irritable bowel, maybe even bladder issues like waking up at night to use the restroom, increased frequency of urination or urgency, and then even reproductive issues, especially with women I see a lot of where there's irregular cycles, painful or heavy, and cramping. I see that a lot. Now, why? That's what a misalignment called a subluxation can do. And then what does that look like on an actual person, a patient of mine? I'm going to show you. So I took an x-ray of this patient and he had no idea what his alignment looked like. He has where individual bones are L2 to L3, L3 to L4, L4 to L5, L5 to S6, and S6 to S1, because he actually has 6 lumbar vertebrae, are all shifting backwards. And they're all out of the allowed amounts, what it should be. And the only way to identify is through x-ray. So what am I doing with a patient like this is I'm doing a chiropractic care and chiropractic biophysics, which is very different from other approaches, to fix the alignment, get a stronger structure, and then actually take pressure and stress off the joints, the discs, and the nerves to help the body heal. This is why I get very different results from compared to when other people go to other types of healthcare providers and even other types of chiropractors that don't take x-rays and actually look at that. So this is something, if you feel that you're having chronic lower back issues, you may have a retrolisthesis. You may have these postural shifts. Only way to get it checked, you got to take x-rays, and then that's what I do. And you got to get on a plan to actually fix that so you can stay healthy your whole entire life.